favor the translocation. So does immune deficiency in stress. The first which happens is that lymph nodes, peritoneal cavity, portal blood are infected. Then all the organs. When the bacteria penetrate the wall, they give priority to what surgeons have left behind. Necrotic tissue, fluid, all blood, etc., etc. And that leads to production of, for example, abscesses. Today, there is a lot of literature on this topic, and if anybody is interested, I'm going to provide Hussein with a big reference list, and contact Hussein if there is anything you would like to know about. Here are some examples on situations when bacterial overgrowth is especially often seen. You probably never thought of the fact that feces is 50% bacteria. But the important bacteria are those sitting on the mucosa. If you look at the bacteria, 1 per million is potentially pathogenic. The 999,999 are benign. They are there to work for you. And they are dominating and keeping the ppms under control. As long as you have a normal, benign flora, the ppms have no chance. And among the benign bacteria is lactobacilla. They are the kings. If there are lactobacilla, other bacteria doesn't like to be there. But lactobacilla are very sensitive, you know. Stress reduces the flora of lactobacilla. Disease reduces the flora of lactobacilla. So does antibiotic treatment. This is the pattern. This is the potentially pathogenic microorganisms in the mouth, from the stomach to the small intestine, and in the large intestine. This is the flora of anaerobic flora of the benign bacteria, the cleaners. As long as they are present, those have no chance. It's fantastic. We have got a lactobacilla locker in every opening in the body, you know. The mouth, isn't it fantastic? We have open mucosa, but it doesn't get infected. In the rectum, in the vagina. This is meant to be so. But if we, by irradiation or by antibiotic treatment or other careless treatment, destroy this flora, that gives this a chance. Now you should look at the next slide. If we eliminate the anaerobic flora in the gastrointestinal canal, we will immediately give priority to Streptococcus fecalis, Staphylococcus aureus, Enterobacteriaceae, Escherichia coli, Klebsiella, Proteus, Enterobacter, Pseudomonas, Candida. Have you heard these names before? Yes, in the intensive care. That's those bacteria you help to take the dominance in the intensive care by your treatment. And after a week or so, they are the kings, and they set the fate of your patients. This led Dutch bacteriologists and infectious disease doctors and intensive care doctors to develop a special concept called selective decontamination. A very extensive prophylactic treatment in every patient based on polymyxin, tobramycin, and amphotericin. Oral application and gastrointestinal application. A very troublesome treatment for the patients and a Very troublesome treatment for the nurses. It is very difficult to get that sort of treatment popular. And the results haven't been good. It's true that